11 control.
My name is Santosh. Poonnoose. I'm one of the neurosurgeons here in Adelaide and have been involved with the founding of the South Australian Neurological Tumour Bank. The concept of a bank is pretty much the same as any bank. You have people contributing to the bank and then the bank invests it. And so the way it works is the contribution is in the form of tumor tissue that's stored in the bank, and the investment is in the form of getting researchers and world-class researchers in SA to use that tissue. And so it's about getting the most out of every precious bit of tumor tissue. And the way we go about it is by, like any investment, diversifying. And the way we do that is by distributing this tissue in a systematic way between all the researchers, and you've heard from some of them previously. It's to maximize the utilization and the information that we get out of it by creating a network amongst us. Sometimes size, the numbers, the smaller numbers here are seen as a disadvantage, but I think we can use it to our advantage where we have a small group of people that do these surgeries as in neurosurgeons, and we can effectively collect all the data for our researchers. So the role of a neurosurgeon, which is what I am, is actually a bridge between the people that are contributing and the people that are utilizing our investments. And we are able to communicate the clinical information which the researchers don't have access to. And so this tumor bank entity helps to facilitate clinical research. What is its impact in South Australia? 8 years ago, before we started the SANTB, as it's called, there was no tumor research in the state. Right now, we have more than 8 or 9 basic science research labs working on trying to translate their lab research to clinical use. Millions of dollars have been raised from research funding, and so it's had a huge impact. How has this been possible? It has been possible because of contributions made by different people, general public, raising funds specifically for this. And one of the biggest contributions we've had to be able to start off all of this came from the combination of the Ride Like Crazy Neurosurgical Research Foundation and Flinders Foundation. So that's in essence what the Tumour Bank has done for SA, and we hope to continue to expand the base of our researchers. With regards to the impact that the Tumour Bank has made on research in South Australia, there was some research activity on tumor tissue, tumor-based things prior to the commencement of the South Australian Neurological Tumour Bank. But after we started collecting tissue, the amount of research in this area has expanded exponentially. We have more than 8 groups doing quite significant research work into tumor oncology, and we have raised more than a couple of millions through fund applications, and there's quite an extensive amount of work being done currently through the tissue collected from the Tumour Bank. One of the questions that has been raised with regards to research in this area is that outcomes for glioblastoma treatment has remained pretty much the same for more than 30 to 40 years. Very poor prognosis. This has resulted in a sort of nihilistic attitude towards this particular tumor, with very minimal industry support in terms of funding for research in the past, which has changed now, and also a nihilistic approach from the surgeons at a point where it was considered futile to operate on many of these patients. This very reason motivates me to work harder, because I think we as the surgeons are the ones that need to make that difference. We need to advocate for our patients, and the only way we can do that I have gotten to understand, and all the neurosurgeons here will agree, that it's not surgical. There is some other treatment that is required to get on top of this. And that's why I think a lot of my work is directed towards this, because I want to get a better answer than what we have now, which is primarily surgery. So one of the reasons why this variation survival occurs is the fact that there is obviously some molecular variations that make them more susceptible to treatment. The name glioblastoma multiforme means multiple forms. We haven't fully understood what these multiple forms are. And so I think a lot more work needs to be done to weed out the variables that influence response to treatment. And that is why basic science research is the key to the answers.
Hi, I'm Rebecca Ormsby and I'm the coordinator of the South Australian Neurological Tumour Bank. Welcome to part 3 of the Grey May virtual talk series, and welcome to the South Australian Neurological Tumour Bank Laboratory. The Neurological Tumour Bank is based here at Flinders Medical Centre, but it's a South Australian resource. It was set up by a group of passionate neurosurgeons, clinicians and researchers almost a decade ago, and their aim was to set up a resource that would facilitate research into brain and spinal cord cancers here in South Australia. The role of the Tumour Bank is to collect neurological tumour specimens from patients undergoing surgery to remove their tumour as part of their diagnosis or treatment, and then to pass these specimens on to researchers for their projects. The Tumour Bank consists of 2 co-directors, Dr. Santosh, who's a neurosurgeon here at Flinders Medical Centre, and Dr. Ganesan Kitchenadasa, who's an oncologist also here at Flinders. They oversee the ongoing management of the Tumour Bank. We also have a management committee that spans across both Flinders Medical Centre and the Royal Adelaide Hospital, where we also collect tumour tissue from. And then we have a wonderfully dedicated team of people who donate their time to support the Tumour Bank. And this includes neurosurgeons, clinicians, registrars, theatre staff, nurses, and SA pathology staff as well. And they all help us to consent patients, obtain and process tumour tissue, obtain the blood samples, ensure the consenting is done properly, etc. So we support brain tumour research by employing best practice biobanking principles so that researchers know that they're receiving high quality specimens for their research project. Researchers will generally approach us to discuss their project requirements, and then we'll liaise with the neurosurgeons and the theatre staff to get the specimens that the researcher needs for their project, and this may involve specific tumour types and tumour grades, specific processing methods, different specimen types such as blood samples or CSF, and occasionally normal brain tissue as well. Sometimes the neurosurgeon needs to remove normal brain tissue in order to access the tumour, and this is generally discarded, and this has provided a really valuable resource for many of the research groups that we support, allowing them to compare the differences between normal brain tissue and the tumour sample itself. We also collect patient clinical data that's associated with the specimens that we give to the researchers, and this can be quite comprehensive and includes demographic information, diagnostic info, treatment data and patient outcomes. This is a centrifuge that I use to process some of my biological specimens in, blood samples and CSF. And here on this side we have a Class 2 biological safety cabinet that allows me to process specimens and keep them sterile whilst also protecting me. Both of these pieces of equipment were purchased thanks to the NRF, who have funded this in a recent grant round. We're really appreciative of having this equipment in the lab. Prior to this, I had to use equipment from other laboratories that were quite distant from the Neurological Tumour Bank lab, and so that increased processing time. So having these pieces of equipment here in the lab means I'll be able to process samples much more rapidly, and that allows us to provide researchers with much higher quality specimens. So neurological tumour banks are really important for brain tumour research because in order to study brain cancer you need patient material. Brain cancer is one of those diseases that is really heterogeneous. It varies from patient to patient and it can change over time. So in order to understand the biology of that cancer, to work out what drives the cancer, why it's so aggressive, and to find new and more effective treatments for that cancer, you really need to study patient material. The Neurological Tumour Bank has been really important for brain tumour research here in South Australia as well. Prior to this tumour bank being established back in 2015, there was really very little research happening here in South Australia to do with brain cancer. And the few researchers that had tried really struggled to get ongoing engagement with the neurosurgeons and hospital staff to support their projects. So we play a really important role liaising with the surgeons and the theatre staff to get the researchers the tumour tissue that they need processed in a manner that's compatible for their project. The bank also helps to maximise the use of the tumour tissue coming out of the operating theatres, because often we can share the material between a number of research groups, and so more research value is gained from that one specimen. The Neurological Tumour Bank in South Australia has been really beneficial for brain tumour research here in this state. When I first started in this position back in 2015, there really wasn't any brain tumour research happening in Adelaide, and a lot of people said to me, why do we need a brain tumour bank when there's no brain tumour research? So initially we only had one research group that we were supporting, and that was Dr. Lisa Ebert. And over the years we've increased those numbers of groups that we're supporting, and we're now currently supporting 7 research groups here in South Australia and 1 research group in Western Australia. I think one of the things I find most rewarding about this job is knowing that for every specimen that we collect and pass on to a researcher, that we're advancing the knowledge with regards to brain cancer. What causes brain cancer, why it's so aggressive, and helping to find more and effective treatments for brain cancer. And these advances will ultimately help to save patient lives.